Wandering is one of the most common behaviors associated with Alzheimer's disease. Residents may wander even in familiar places. They can become lost and wander away from the community. They can intrude in other resident living spaces. Wandering can happen at any point during the progression of the disease. So it's important that as care professionals, we never label a resident as a wanderer. Any resident diagnosed with Alzheimer's or related dementia could be a potential wander risk.
Wandering residents are typically residents who are walking aimlessly throughout the community. Usually residents with a dementia diagnosis have a higher potential for wandering, but residents who are also confused and disoriented may wander aimlessly.
Well, I'd never thought that pacing, or what most people call wandering, was aimless, because in that person's mind they're going somewhere. And we may not know where, and they may not be able to tell us, but they're on a mission. And which is fine. I mean, trying to interrupt that is really trying to take away their own right and dignity to pursue whatever they think they're doing. I think the important thing is to realize that they're burning up a lot of calories, and that we need to keep up with their nutrition and hydration. And I think a lot of times it's more of a problem for us as caregivers or operators, and it's probably much less of a problem for the resident.
Wandering may never be an issue for the resident if the resident is safe. Residents who are curious typically wander throughout community looking for companionship or things to do. The best practice for staff is to redirect them to a group activity or to give them something purposeful and meaningful to pursue. Exit-seeking behaviors are typically with residents who have an agenda or a purpose. They are looking for ways to go home, go shopping, or have a reason for wanting to leave the community. An eloper may be very calm. They may be very unconcerned about where they are or maybe even where they're going. They just tend to see a door and want to go throughout the other side. Sometimes elopers will have a plan. They intend to perhaps catch the bus, go shopping, meet their husband for lunch. Typically a runaway may be someone who has higher anxiety, is very determined to leave, may have a purpose and an intent to exit the community, may be angry and anxious, may also believe that they are being held in the community against their will.
Some experts have categorized wandering. It is helpful to be aware that there are different types of wandering which might require different interventions. Let's discuss some of these. In checking, the resident repeatedly seeks the whereabouts of the caregiver or another person. Trailing appears to be an extreme form of checking in which the subject tends to follow the caregiver or another person around excessively, walking closely behind them. There are some particular caregiver concerns you will have when a person tends to trail excessively. First off, if that resident is excessively following close with another resident, that can be very stressful for the other resident as well. So you'll want to make sure that there is adequate time apart. When a resident tends to trail a caregiver, this can be a particular concern when the caregiver leaves the unit. You'll want to be very sure that that resident has not followed you out the door. You may want to ask another caregiver to use methods of distraction to engage the resident in an activity while you exit out of the door away from their sight. Pottering is another form of wandering. With pottering, the resident walks around the community, garden, inside, outside, apparently trying, but ineffectively, to carry out tasks. Washing or drying things, cleaning, weeding, etc. With pottering, the caregiver can help the resident be successful in tasks. Give them simple one-step things to do, or work side by side with the resident so that they can feel the accomplishment of completing a task. Aimless walking. The resident walks around inside or outside without there being any evidence of a purpose. These residents often just aimlessly roam the facility, opening doors, closing doors, walking down the hallways, walking in common areas, without what appears to be a particular purpose. A major caregiver concern when we have a resident who wanders aimlessly is that they may be walking so much that they are burning so many calories. Weight loss can be a concern.
I think the important thing is to realize that they're burning up a lot of calories and that we need to keep up with their nutrition and hydration.
Fatigue can also be a major concern. The resident simply exhausts himself by walking and walking. It is very helpful when you can engage this resident in activities. If they allow you, take their hand and sit down, encouraging the resident to sit with you and rest for a little bit. Offering the resident a snack at a seated table can also be helpful. Walking directed towards an inappropriate purpose. The resident's walking seems to be directed towards a purpose, but the purpose is inappropriate. For example, this could be a resident who searches and searches for a deceased relative. When walking directed towards an inappropriate purpose, you may find that this resident often invades the privacy of other residents by going in and out of their rooms.
Most of the people that we find go in other people's rooms are picking up stuff and dropping off other stuff. And we have several of our residents right now that created a lot of problems that way. They take hearing aids and dentures.
You may find that this resident could have increased agitation when they're not able to find what they're looking for. Redirecting this resident in an entirely new activity or thought line could be helpful. You may also find that it is helpful to reminisce with the resident, looking at positive items such as photos, etc. The resident is on the move for an abnormally large part of the time. Perhaps this resident also associates with aimless wandering as well. This resident is busy, busy, busy. Again, like some of our other concerns where a resident is walking constantly, we want to be aware, are they getting adequate periods of rest? Are they getting proper nutrition? Sometimes residents will enjoy activities of a repetitive nature, such as sorting items or counting items. Nighttime walking. This is a resident who wanders frequently during nighttime hours. Now, of course, this would not apply to a resident that simply needs to get up a few times to use the toilet during the night. We're talking about a resident, again, who is wandering during nighttime hours. This resident must be checked frequently throughout nighttime hours. We can never assume the resident is sleeping safely when they tend to wander during nighttime hours.
I think vigilance on the part of the caregivers, continually checking, being vigilant when visitors are around are the main things.
In addition to providing nighttime checks, make sure the physical environment is comfortable for the resident. They have enough blankets on their bedclothes fit properly, they've had adequate hydration, and so forth. Provide comfort and reassurance to the resident during these nighttime hours. Chronic exit-seeking behaviors. Not all residents who wander will leave our community, but we should assume that all residents are at risk. Some residents are elopement-seeking rather than wandering. A resident who has strong exit-seeking behaviors is a very significant safety concern for us and will need definite reevaluation. As you can see, wandering does take on many different forms. What's important is that you as a professional caregiver know your resident needs. You know the typical behaviors you can expect, but you're always ready for the unexpected.
It's always important during the assessment process to ask the family about the history of the resident. Do they tend to stay with their loved one as a companion when they're walking through shopping, for instance, or getting in and out of cars? Or perhaps do they intend to wander off? Has there ever been any history of wandering? Has the resident ever exhibited or exclaimed that they would like to leave a certain area? All this information needs to be collected during the assessment period to better prepare for when the resident arrives at the community.
Learn as much as you can about your residents' past so you can see how that might influence their behavior today. What kind of job did they have? Did they have any particular lifelong routines?
Well, of course, we do have pre-screening with the family, and we try to go into the home to actually observe the person ourselves. We get the physician's report. And then again, we try to be sure they have the right diagnosis. I mean, do we have a younger person with frontotemporal dementia? If we do, we kind of know what to expect.
How the resident typically spends the day is very important. Observation, monitoring, knowing the resident's pattern, and also learning about the triggers which may trigger a resident to getting up and moving about aimlessly or perhaps even attempting to elope. What is most important, however, is that the staff does not become complacent in always expecting a resident to do the same thing.
Gather as much information as you can about the resident. Chit-chat with the resident and listen to what they have to tell you. Speak with family members. Look in the activity portion of the resident's chart. All of this can be very helpful.
Sometimes there are triggers that are unannounced or unidentified which may make a resident get up and suddenly decide to leave. Usually the triggers are established from something emotional that the resident may be experiencing. Maybe having discomfort. Maybe they think they see somebody they know and want to follow after them. Maybe they hear a loud noise and become frightened. These are things that again have to be observed for the resident's response. Increased wandering behaviors may occur at certain particular times throughout a community's day. It's always important for staff to be aware during high peak times, such as during entertainment when there may be larger crowds or increased noise levels. Wandering also may occur after meals or perhaps during shift change. These are high times that staff needs to be alert, on the floors, and monitoring their residents very closely.
I think for us in our secured perimeter buildings, we have to always watch the exits. I think the biggest area where we have trouble is when visitors come and they don't know who's the resident and who's a visitor, and they're pretty good about trying to follow you out of the building, and so you have to watch that. We also say when people come to work at the building, whether it's the gardening people or somebody working on the building, caregivers be very careful to watch the residents then.
There can be many causes for wandering. Let's look at some of the common causes we might encounter when caring for our residents. The first being unmet physical needs. A resident may be hungry or thirsty. They may be in search of something to eat or drink. The resident may have a physical discomfort, such as the need to go to the bathroom, and they're looking, but they're unable to find the toilet. Past behaviors and routines can be another cause of wandering. For example, a resident may have had a lifelong established pattern of meeting a certain responsibility at a certain time each day. And so when that time occurs in the community, they may be seeking to meet their responsibility. They may not like the particular activity that's being offered in the community at that time. Or maybe it's a downtime in the community, but they need something meaningful to do during that period. Remember, residents' needs do not always exactly match our activity schedules, so we need to be able to improvise and meet each resident's need. Wandering may be related to anxiety or fears. Whether or not it's real or imagined, it feels real to the resident and can cause them discomfort. A resident, for example, that's having hallucinations or delusions may be far more apt to wander about the community. Stress can also be a cause for wandering. And you know that stress can come from the resident or even from us as care professionals. If we come to work with an attitude, maybe we brought concerns and worries from home into the facility with us, that can actually rub off on our residents. You may see their increased behaviors related to agitation simply because of our attitude at work. That's why it's important that we create a pleasant environment for the resident. Sometimes residents have stress related to being rushed to get ready for an appointment, or they may have a physical demand such as receiving a bath or personal hygiene or grooming can sometimes increase their stress level. You can even have stress that is related to very pleasant events. For example, maybe a resident has had several visitors that morning, their grandchildren, their children, friends. While it was great to see all of those individuals, at the same time, it can increase the resident's stress level, thus increasing their propensity to wander. Medications and treatments can even have an effect on wandering.
I think it has its place. I also know that it's our biggest problem in our buildings. Polypharmacy continues to be an issue, not only the various drugs, but the amount that are administered. Most dementia patients do well on pediatric doses instead of adult doses.
If you have any questions or concerns that maybe a medication is causing problems, speak to your supervisor or the resident's physician. Your pharmacist is also a good resource. Let's review some tips when caring for residents who might wander.
Place nightlights throughout the facility. This helps the resident identify certain rooms, particularly the bathroom if they're looking for the bathroom during the nighttime. Remember to keep medications and toxic substances secured at all times. Reduce noise levels. Don't forget the high noise level times during housekeeping, particular activities, and meal times.
Sometimes there can be triggers for wandering. Learn what those triggers might be. For example, some residents are uncomfortable when a lot of residents gather together. Maybe there's a particular activity going on in the activity room and there's lots of residents coming in and getting seated. Some residents feel uncomfortable with that, and that's a prompt for wandering. You may wish to engage that resident in a different activity that they would enjoy more.
Make sure your outdoor patio areas are safe and intriguing for a resident, yet safe to provide resting places and things of interest for them to pursue. For example, your foliage should always be non-toxic. Clearly label all residents' doors so they can identify their rooms, particularly their bedroom and their bathroom. Make sure your community maintains updated photos of the resident. Furniture should also be safely placed so as not to have obstacles in the way of a wandering resident. Make sure the residents are engaged in activities throughout most of the day, things that the residents like to do. Even a short walk in fresh air could be very refreshing for the resident.
Sometimes we have many activities concentrated during one time period, but there are long stretches where activities are not going on. Always keep your resident engaged in meaningful activities.
If you have a few residents who are wandering at the same time, it may be a good opportunity to organize a health walk. Residents can join together and walk outdoors or throughout the community, more guided than just aimlessly wandering. Observe your residents for patterns of wandering. Some residents may have a particular time of day when wandering is more prevalent. During sundowning, late afternoon or early evening, residents' behaviors of wandering may increase. Make sure you plan for these moments, whether they're engaged in a constructive activity or even some one-to-one quiet time. Residents usually respond when they are connected to another person.
If a resident appears fearful or anxious, try and determine why. Talk to the resident. Remember, it is their reality. Never diminish their concerns. Listen attentively. Provide gentle reassurance.
Don't forget that there may be a physical reason residents are wandering. Check for bathroom times. Make sure they are comfortable, not too hot or too cold, and make sure they're not in pain.
Anticipate the resident's physical needs. If it's been a couple of hours since the resident has eaten, you know they might be needing a little snack. If it's been some time since the resident has used the toilet, Offer to escort the resident if necessary. Be sure the resident always has plenty of fluids available.
If a resident is trying to leave and already at the door, it's real helpful for the caregiver to approach the resident in a gentle, calm manner. Try to redirect the resident to something that may engage their attention. Perhaps it's a snack, perhaps it's something to do, or perhaps it's to walk to a particular destination. Usually the resident can be redirected easily. If there is a moment that a resident becomes agitated, is insistent, or perhaps goes through the secured area, it's always best for the caregiver to remain calm and continue to accompany the resident. At the same time, it's very important that that particular caregiver contacts staff to ask for some backup support if necessary.
The simple things are, don't approach the person suddenly. Try to approach them from the front so they see you. Don't use a lot of repetitive words, just simple statements. Attempt to redirect the person by bringing a subject that they love to talk about. Of course, other things like, of course, in the late afternoon, being sure they're hydrated, have proper nourishment, and try to redirect them to a quiet place where they can settle down.
One technique that is very successful is to use what we call change of face. A new caregiver can approach the wandering resident or the resident with an intent to elope, to join her, maybe invite her to something friendly and social. Typically, the resident will respond to that new voice and new face and may be very willing to accompany them. The original caregiver can then slowly back away and remain nearby for support. Okay. A big smile, a message to the resident that you're happy to see them, is always one way to get the resident's attention. Inviting them to join you, perhaps to an activity, perhaps to share a meal, is always a welcoming thought for a resident. Sometimes asking for the resident's help or assistance in doing something together will have a resident be very cooperative and return to the community with you. Offering the resident time to share a favorite hobby, make a phone call, take a walk, perhaps look at the family album, would be a very helpful. Bringing up familiar names, familiar items or places, engaging the resident in conversation that is meaningful to them. Keeping the resident engaged in meaningful conversation may provide the resident a different focus from eloping. Disagreeing with the resident at the time the resident wants to leave usually doesn't work. Gentle and calm demeanor is most important. Things like, "You can't do that," "You can't go there now," usually irritates the resident and may make them more intent on accomplishing their goal. Careful on any physical approach. A resident who becomes highly agitated may easily turn and swing. If we are wanting the resident to be with us, it's always good to gesture or perhaps offer your hand and ask the resident to come with you. Never pull or force a resident away from the door. And please do not block the door, as that is restraining the resident. If the resident is intent on leaving and actually leaves the secured area, it's the caregiver's responsibility to call for help. Notify other departments, notify other caregivers so that everybody is alerted into meeting and greeting the resident and using redirection techniques so they can redirect them back into the community. Sometimes it takes more than a few minutes to redirect a resident back into the community. Our caregivers may be going for a brisk walk. Other caregivers may be involved in redirection, but in a good amount of time, residents typically begin to retrust and are easily redirected back. Remember, to safeguard your residents' well-being, Monitor their whereabouts at all times. Make sure you implement a safety check program where residents are periodically accounted for throughout the day. Make sure that change of shift time is calm and that most residents are engaged in activities to deter from the confusion. Make sure residents are led to the bathrooms after meal times or to a group activities so they don't wander aimlessly from the meal. And most important, make sure that resident safety is #1 on your agenda throughout your caregiving day.
Caring for persons who wander is always a professional challenge. But the more care techniques you know, ideas for creative activities, good resident-specific interventions you have ready is what makes you a fantastic professional caregiver. Much success to you as you care for persons who wander.